for a competitive athlete, a high-level competitive athlete, just like your baseball player and your football player, they want to know that they're seeing the right person. And there are certain language that we use, there's certain terms that we use that when you use that as a part of your rehabilitation process, obviously it just makes the athlete just feel a whole lot better. So let's look at some of the research around BFR. I want you to watch this video as I'm discussing this. This was a study that was done on injuries, and it was really taking a look at how often people train. The average person is training 3 to 4 days per week, and that is really all belt ranks, from white belt all the way to black belt. Typically training 3 to 4 days a week. 58% of people report some form of an injury. This is a sport where there is joint manipulation, so there is a ton of orthopedic injuries. 32% of those report a knee injury, 16% report a shoulder injury. The most common injury that happens in this sport is a knee injury, and 22% of those are ligamentous injuries. Typically, your lower belts are training 3 to 4 times per week. When I say lower belt, that is a white belt or a blue belt. When they train at that level 3 to 4 days per week, because they're just starting to get to know the sport, there's a lot of things that go along with that. They tend to be a little bit more spastic. They tend to come at you a little bit more aggressively. They tend not to tap as quickly as they should, which all of that ends up resulting in someone being injured a lot more. So white belts and blue belts that train 3 to 4 times per week are 5 to 6 times or 6 times greater risk for a musculoskeletal injury. So this is good to know, right? So if you're working with your lower belts, blue belt, white belt, and blue belts, is helping them go back to the sport, but maybe not at the frequency of 3 to 4 times per week. Now I want you to watch this video right here. And what happens is the guy on the top places the other guy's wrist underneath his chest, and then he sits on it. That's called a wrist lock, and that's called a wrist fracture. So that was an active wrist fracture in a competition. You can see how fast that happens, and it doesn't really look like that much, but this is how it actually happens. So this is a study that looked at BJJ competitions, 116 bouts, 232 exposures. What they found is over those competitions, there was 28 abrasions, 11 concussions. That is a concussion. That's not loss of consciousness. So what this study did not do is record loss of consciousness, which I think more and more studies are starting to do because it is very common with the sport for loss of consciousness. 11 orthopedic injuries, and you can see what those injuries were right there. So other common injuries, labral tears of the shoulder, rotator cuff tears, AC joint separations, dislocations, anterior dislocations are the most common that you see in the shoulder. Sometimes what they'll say is that they have pain with grips and throws, pain with pulling guard. Pulling guard a lot of times is that labral tear or the biceps tendon. When they have to grab a hold, it's like doing a heavy row, because you grab a hold of their collar, you pull them towards you, and you're pulling with a lot of force. So the other thing that people will complain of with bicep tendonitis as well as labral tears is they'll tell you when they're doing spider guard, because you have to hold on to the person's sleeves and you're constantly resisting pulling. So it's kind of like doing rows with cables, but you're constantly being pulled back and forth. So it's both eccentric and concentric motions that you're going through the entire time. And I'll speed up because I know we're getting close to time here. Elbow, obviously, there's a lot of elbow injuries that occur. Hands as well, hand dislocations. That was actually a picture of my finger when I went in to grab somebody's gi. That's pretty common injury. You can self-reduce those pretty easily. And then taping is very common in the sport because the taping really helps to release the pain on the joint. The easiest way to, how I think of it, is it acts like a chopat strap at the knee. So when you're taping the knuckles like that, it's kind of like a chopat strap and helps to distribute that force over a larger area, and it helps to reduce the onset of jiu-jitsu fingers.